most of the MRIs don't include, the sort of MRIs we do don't include imaging, at least definitely the T1, and very few the C8, which could be accounting for the problem half the time. You know, the other issue with MRIs is we never see an MRI identifying inflammation of a nerve. Yet, that's what we're likely treating. So we're treating a condition known as radiculitis. Because if we see a patient and there's a disc herniation, let's say for example, and we do an epidural, and the patient gets better, well, the disc herniation is still there, but we must have treated something else, which is probably inflammation of a nerve, which is why it got better. If you treat it with medications, whether it's a meteral dose pack or various other medications, or if you treat it with physical therapy or manipulation, it doesn't matter. If the pain goes away, that disc pathology is still present, so you've created a state where you have a pathology that's clinically insignificant. So maybe it wasn't just because you had the presence of a disc pathology, it didn't mean it was symptomatic to begin with. So we're looking at, you have to really pay attention to the imaging studies and realize that the imaging study should not be the way that you're diagnosing the patient. The most important tools are the history and the clinical examination. And then the imaging studies give you a little bit of extra information that you really need to clinically correlate with the patient. Because we bring it down to, you know, if there was an injury, let's say from a car accident, well, that might not have anything to do with the degenerative disc disease that you're seeing on an imaging study, such as the MRI. So the time factor wouldn't really correlate.